My name is David Schoenfeld, and I'm a developmental behavioral pediatrician, and I direct the National Center for School Crisis and Bereavement at Children's Hospital Los Angeles. And I wanted to welcome you to this webinar, which is being hosted by the American Federation of School Administrators, the National Association for Elementary School Principals, and the National Association for Secondary School Principals. All of these are founding members for the Coalition to Support Grieving Students, and I'll come and tell you more about that near the latter part of the presentation. I'm going to be talking about leading in the aftermath of crisis, talking about how to care for ourselves while caring for others. And it's very difficult to lead in a crisis situation, but before I get started in talking about how to do that, let me just start with some basic terminology that I'm going to be using. I did want to also give you a little bit of information first, though, about the National Center for School Crisis and Bereavement. We were established formally in 2005, but actually we originated from a program at Yale that started over 35 years ago. Our goal is to promote an appreciation of the role that schools can serve to support students, staff, and families at times of both crisis and loss, as well as to enhance training and professional education programs and serve as a resource for information, training materials, consultation, and technical assistance. And I'm going to go over a little bit about what our center does because I do want to emphasize that immediate information and consultation technical assistance is provided to schools and other community leaders in the immediate aftermath of a crisis event at no cost to the school. So I thought you might want to know a little bit more about what we do and how we do it so you can access those services and support. Through a transdisciplinary team of medical, mental health, and school professionals, the center provides confidential on-site as well as remote technical assistance and consultation for school leaders and school professionals. And I'll show you some of the places where we've been and provided on-site support. We also provide practical and timely advice. We have a 24/7 toll-free number, and as well as informational email addresses that we monitor 7 days a week. So you can get in touch with us pretty much at any point if there's something going on and you would like some immediate support. We provide ongoing support, though, not just in the immediate aftermath of a crisis, but throughout the long-term recovery period, even into the renewal period. Renewal is often considered recovery more than a year out after the event. I prefer to think about it as recovery is getting back to where you were. Renewal is going to where you ought to be. So I was telling people during the pandemic, our goal is not to get back to the way we provided behavioral health supports to children in schools before the pandemic, but actually how we could do it even better. So I know there was a leader, just getting back to the way you were is often a lot. So thinking about how you can even do better is even more challenging, but it's also a good time to be able to do that. We do develop and make available free educational resources and crisis management tools, and we do school staff training and community presentations and professional development for a wide range of professional audiences. I'm just going to give you a little bit of sense of some of the crisis events we've responded to in person, because most people have never heard of the National Center. And some of that is really relates to the way we approach things. We feel that we do our best work when we do it behind the scenes, when we empower the local school and school district and community to deal with the crisis event most effectively. And so we're therefore behind the scenes, and because we're behind the scenes, most people don't know we're there unless you're the school leader and we're working directly with you, or your staff will know as well. And so people have referred to us as the best kept secret. It is not actually really that good to be a secret for something like this, because then you guys don't know how to reach us. And so that's why we're talking with you directly about it. We responded to the World Trade Center attacks in New York City in 2001, and we provided training for the school crisis teams in the school system. We really provided training for a school crisis team in every school, which was, I think, about 1,200 at the time. And at that time, they had a little over 40 school districts. And then we also established and ran a citywide school crisis team. And we continue to work with New York City schools. So we went back after Superstorm Sandy, and then we were also there when the pandemic hit. New York City Schools was becoming part of the Grief Sensitive Schools program, which I'll tell you about briefly. And so I was already doing training there in person. And I had something scheduled for May of that first year. And we ended up canceling it and switching to virtual support. And the support focused on the pandemic and then how to support grief. And so during the first year, we did live, but virtual trainings predominantly for about 20,000 of their school staff. We've also been working with many other schools and communities across the United States, both during the pandemic and during the recovery period. We worked closely with Broward County Public Schools after the shooting in Parkland, Florida at Marjorie Stoneman Douglas. We actually went out monthly for several years until the pandemic hit. Then we went more virtual, and then we resumed in person when it was safe to do so. We coordinated the response for the school shooting in Newtown, Connecticut, at Sandy Hook. For the first week, we coordinated the response. We have been working with the Annunciation School after the shooting, and that was in Minneapolis, Minnesota. My last visit there was in December. We responded to the school shooting in Winder, Georgia, as well as the community shooting in Las Vegas at Mandalay Bay. We worked with Clark County Schools, but we also worked with the city and the Nevada chapter of the American Academy of Pediatrics. We responded to the school shooting in St. Louis in 2022, one in Greenville in 2022 as well. A teacher was murdered by two students in Fairfield, Iowa, out in the community. And so we responded to that in person as well. And the school shooting in Santa Clarita, California at Saugus High School. We worked with them over some time to help them with the recovery from that. And there really have been a lot of other school shootings and stabbings and other violent incidents that we've worked with schools across the United States. We also respond to natural disasters. So we responded to Hurricane Helene, Tennessee. We're going back out there next month. We responded to Hurricane Maria in San Juan, as well as Hurricane Katrina in New Orleans and Ike in Galveston, and other natural disasters, including tornado destruction in Joplin, Missouri, and in Alabama, and a lot of wildfires. We're currently working with the schools impacted by the Eaton Canyon and Palisades wildfires in Los Angeles area. I'm actually going out there right after I finish this presentation to meet with them. We also responded to the wildfires in Maui, and I'm going to be returning to Maui, and we'll be meeting with people in about a week and a half. We also responded to the wildfires in Butte County, California, Sonoma County, Sevier, Tennessee. So there's really been a lot of places where we've responded in person. In case people are interested, we do some international work as well. We responded to the Akita Elementary stabbing in Osaka, Japan. I think there were 8 children between 7 and 8 years of age that were killed. I think there was something like 15 other children and adults who were seriously injured from that. And so we went out and provided some support. We also responded to the earthquake in Sichuan, China in 2008 that killed 69,000 people. And many schools collapsed because of the construction quality of schools at the time. And so there were a lot of children, unfortunately, who died in that earthquake. And we went out for multiple visits to assist the community and the country in the response. I've gone out a couple times to Italy to consult on Ukrainian refugees. They have one of the largest Ukrainian refugee populations in Europe. We also have been providing some support to Israel. I went in person before the war. I have not gone out since the war started, but we did do some virtual training to educators and school psychologists around the time of the war, and are still providing some support and work with them. And these are just some of the other countries where I've gone in person. Usually they're at pediatric conferences after a disaster has occurred, where I covered the topic. The only one that I did not go in person was in Pakistan for safety reasons, and that was done virtually. So you will see there's a lot of different places where we've gone out, and I'll be drawing on that experience when we work with schools throughout the country to try and give them additional assistance. So I want to talk a little bit about our philosophy and approach and how it differs from perhaps how other people might approach this. Our philosophy is that a school response to a crisis is not the same as a clinical approach that's applied to every child in the school. So a lot of times people use what I call the medical model. I am a pediatrician, so I'm trained in the medical model. But that's kind of the screening people to try and see if they have symptoms of mental illness. And then if they do, you do further evaluation and try and reach a diagnosis. And then you refer them for treatment. So that's kind of a medical model of dealing with a crisis. But I think what we've found is that whether it's the pandemic or terrorist attacks or large scale natural disasters, that doesn't work well when you're dealing with a school crisis. And really, we need to shift away from reliance on a medical model more to look at a public health approach. So, what we suggest is your primary response should not be trying to diagnose mental illness and refer for treatment, but rather it should be providing universal support. In the schools, we refer to them as tier one services, where the primary response to a major crisis event is really to foster building resiliency. And then referring those who need more for treatment, of course. But the primary focus is the universal support. And schools can provide supportive environments to students and staff in the aftermath of crisis and loss. And that doesn't require that everybody in the school is there to provide treatment. So that's one of the things I usually clarify to staff is that we're not asking you to become therapists. We're not asking you to diagnose mental illness. We're asking you to be empathic and supportive and make appropriate accommodations for the learning of these children. I often show this video clip. I, I was talking with a middle school teacher, and she mentioned how one of her students returned to class after he had been out for a week. And the teacher knew that he had been out because his mother was hospitalized, but she didn't know that the mother died until the kid came back into the classroom. And she said, I gave him a hug and I was like, I'm so sorry. And even when she talked about it, she was a bit emotional. And she goes, like your mother, like, and the kid just got embarrassed and said, please don't do this. So she said, okay, but know that my door is always open. And whenever you are ready to talk to me, you can come and talk. But the kid didn't come to talk with her, but he did stop by after school just to thank her. And when she asked why, she said, what are you thanking me for? I didn't do anything. And he said, you were there and I didn't have to talk about it. And she said, she realized then that sometimes kids don't want to talk about it, but she's, and, but she was there. She had acknowledged it. She said she would help. And that's really all he wanted from her. And she said to me, it's kind of like a dance. I take the first step. If the student takes the next step, that's fine. We'll continue the dance. Otherwise, it's okay. We can just stop and listen to the music together. And that's what you really are doing often after major events, is you're listening to the music together with these kids. And so knowing how to have an empathic and supportive presence is an important skill set really for everyone who works in a school. So in the immediate aftermath of a crisis response, often what we recommend is what's called psychological first aid. And this is something that is provided broadly to all of those who are impacted. So it's every child and every staff member in the school. And what it really involves is supportive services, such as, meeting their basic needs or giving them psychoeducation that helps them understand what are some of the common reactions that people might have? And more importantly, what do you do when you have those reactions? What you're trying to do is just promote the normative coping and accelerate the natural healing process. So it is not a treatment, it's a supportive intervention instead. We really feel it's important that all adults should understand the likely reactions that children and adults can have to a crisis and how to help children and adults cope with those reactions. Because anyone that interacts with children after a crisis event, or really even outside of a crisis event, can be a potential source of assistance and support. But if they're unprepared, particularly if they appear disinterested, they can actually become a source of further distress. So we really want everyone who interacts with kids to be prepared to be supportive to them. I should have said in the beginning, I'm talking about large-scale crisis events, but actually these skills apply for even if it's a personal or family crisis. People get into upsetting situations, and we really want the adults around these kids to be able to help them when that occurs. So I went out to Flight 93, the Flight 93 Memorial outside Pittsburgh to do some training for them. So Flight 93 was the flight that did not come down when they grounded all the planes on 9/11 because they actually had terrorists on board. Um, that flight had been delayed by air traffic control, so it was out of sync with what happened in the Pentagon and at the World Trade Center. So the passengers and the crew knew there were terrorists on board because they had taken over the cockpit. But they also got phone communications from the ground through their personal cell phones. And people told them what had happened at the World Trade Center and at the Pentagon. And so they knew they couldn't just cooperate with the terrorists. They had to do something to try and overpower them. So they attempted, and in the process, the plane crashed outside of Pittsburgh. But there's a kind of a small museum which is dedicated to the passengers and crew of that flight and tell their story. It's quite moving. You listen to some of the recordings that of the telephone conversations that they had before the plane crashed. And it also is a national park that's quite beautiful, but it's out in the country. It's about an hour outside of Pittsburgh. So anyway, I went there and I did the training, and I went over psychological first aid. And somebody came up to me and he said, "You know, I oversee a lot of the groundskeeping for this memorial." And he said, "And I have trained my staff. If they're cutting the lawn and they see a visitor, they're to stop what they're doing, establish eye contact, and ask if they can be of assistance." And he looked at me and he said, "We're not here for the lawn. This is sacred ground. We're here for the visitor experience." And I thought to myself, well, actually, they are there for the lawn. I mean, they're part of the National Park Service and it's a national park and they're paid to cut the lawn. But they knew that. The point was they knew there was a higher purpose. And I always tell people, if somebody who cuts the lawn for the National Park Service can understand that, then anyone that works for your school should understand that they are there for the student experience. I don't care if they're bringing supplies, if they're an outside contractor that's delivering paper, they are there for the student experience as soon as they walk on your property. And so making sure that everyone is kind of trained because you will always be remembered by the one insensitive comment that someone made, often in the front office or another. Usually I say front office because they have a lot more interface with the general public. But you can also be remembered by the one act of kindness of any of those same employees. So you want to make sure they all know how to be supportive and helpful. They also have a different perspective on how kids and staff are doing after a crisis event that can actually help you both identify need as well as deliver services and support. I went to one school that had had a mass shooting. They were a high school. And I was talking with the cafeteria staff, and they said that they noticed the girls were wearing long sleeve shirts. And I asked them why they thought that was relevant. And they said, you know, they get on the lunch line and they hold out their tray, and we can see that when their sleeves retract, that they've actually been cutting more. And that's why they're wearing long sleeve shirts, even when it's not that cold out. And I asked them, did you tell the mental health staff that? And they said, no, we just work in the cafeteria. We're not mental health providers in the school. And then I talked with the custodians, and they told me that they noticed that the students were now out of control. And I remember asking one of them, give me an example. What do you mean by out of control? And he said, okay, the other day I was walking through the cafeteria and a group of kids left their trays on the table. I reminded them they needed to bust their trays, but they ignored me and kept walking. So I stopped them and I said, you know, if you leave the trays on that table, they're not going to go away. So the kids went over, they picked up the trays, they went to the door and threw them out of the building and just turned to the custodian and said, they're not on the table anymore. Are you happy now? And he said, those kids would never have done this before the shooting. But what worries me most is they're not going to do that in front of the administrators. They're not going to do it in front of their teachers, and they're not going to do that kind of behavior in front of their parents. And he looked at me and he said, we see a different side of these kids, and we're really worried about them. And then one of them said, yes, and they're having sex on campus during school hours. We know where and we know whom. So they literally see a very different side of these kids, and they may be the ones that are most accessible to some students when there's been a crisis and can actually help them. So we want to make sure that everybody gets this training. I think it's next month, doing a workshop for the NEA conference, but it's the NEA ESP conference, the Educational Support Professionals. And I've done training at that conference for up to a full day and found that they had a certain number of slots and they had twice the number of people who signed up for it. Like they had to add extra chairs for a full day workshop because educators and educational support professionals really want to learn this if they're given the opportunity. So I don't have a lot of time to go over psychological first aid, but I just want to go very quickly through it so that you at least have some understanding of what it is if you choose to look into it further. So the first is observation or awareness. And I'm going to address some of the common symptoms of adjustment reactions that you might expect. Then you want to make a connection, help people feel comfortable and at ease, and be kind, calm, and compassionate. So people pick up on how we speak rather than what we say when they're in a crisis situation. I always tell the story that I had somebody who worked with me who contacted me when she found out that she had cancer and asked if I would go with her to the first oncologist visit along with her husband. So I went to the visit, thought the oncologist did a really nice job. It was about 45 minutes long, as I recall. And we walked out of the room and she just looked at us and said, "So I don't have cancer." And I was like, "Why do you think you don't have cancer?" She said, "Well, he seems so hopeful." And I was like, "He's hopeful you'll get cured of your cancer, not that you don't have it. You actually signed a consent form for surgery tomorrow to remove the tumor." And then he went over the chemotherapy regimen for after the surgery, and you signed that as well. Do you not know that you have cancer? And she just repeated, "But he looked so hopeful." I think that's the reason she had me come and her husband so that we could listen to and help her with the information. But I will tell you, she worked with me doing crisis response, and she was a very level-headed person. So she wasn't hysterical or anything. She just couldn't process all that information. The next thing is assisting with basic needs. And if you're school leaders, you know this is an issue every day. If a kid doesn't have a place to live, doesn't have clean clothing, doesn't have food, they're not going to be able to do anything else in terms of learning. So the first emotional need is actually to have your basic needs met. So I was in New Orleans after Katrina, I think it was a couple months afterwards. Someone told me that they were in church on Sunday, and uh, in the middle of the chaplain speaking, somebody's cell phone went off, and all the audience kind of made noise about how inappropriate to do this during the sermon. And the chaplain just stopped what he was saying, turned to the congregation and said, "That call might be your contractor. You better get it." And so the person who was telling me this said, my chaplain, he really gets us. He knows what we need. And as a leader, you will always want everybody to say that about you to the extent that you can. So the point is, after a disaster, make sure you assist people with their access to meeting their basic needs. You don't necessarily have to personally, or even in the school itself, provide all their basic needs. You can, but you certainly need to recognize that they have them and help them figure out how to get their basic needs met. The next step is to listen. So being able to actively listen is even more important than knowing what to say. You want to give realistic reassurance, but not false reassurance. Encourage good coping and help people connect. Help them identify supports in their family and community, and also help them figure out how they can help others. Some of this is because psychological first aid is usually done by strangers in about 10 to 15 minutes with people they've never met and will never see again. So you really have to connect them up to others who can continue the work. You're really just starting to help them begin to cope. Obviously, in schools, you have ongoing relationships with the students. So you wouldn't just be providing psychological first aid, but some of these strategies are still useful. If a crisis is unfolding, you want to give accurate and timely information, but not unnecessary amounts or graphic details. You want to then suggest a referral resource again so that they can continue the work and then end the conversation. So all of this, as I said, takes about 10 to 15 minutes, and you can do it with people you've never met. And it's often quite helpful to them. But I'm going to move, this is what you do in the immediate aftermath. But now let me turn to, what do you look for? Because if you know the adjustment reactions, you're more likely to identify kids that might value or need additional support. And so this slide outlines some of the most common adjustment reactions. I do want to say the most common one is not on the slide, and that's nothing, because most people hide their distress. Kids do this pretty well, particularly as they get older. Adults are even better. School administrators and administrators in general are really very good at hiding their distress. Get back to this later. That's not a superpower. That's actually a problem. People should not be hiding all of their distress. They should be accessing supportive services. But let's go over some of the things that you may see. So the first thing is fears. I think most people anticipate that. You've been through a tornado and you go outside and it's windy and you become concerned. Um, you're fearful of what happened or of a recurrence of it occurring. But you can also become anxious, which means you may be fearful more generally and not just about what happened. So you may find, for example, that a shooting happens in daylight, but the person becomes more scared of the dark. They just become more fearful, and that's the anxiety part. And one of the major types of anxiety that we see has to do with school avoidance. So separation anxiety. Kids will be afraid to leave their parents and other caregivers after something tragic has happened, even if it happened at home while the school was not in session. And parents will be reluctant to separate from their kids as well. So I always tell people, you will see kids in distress after events and pay attention to them. Pay attention to the kids who aren't showing you their distress because they're likely having it and not demonstrating it. But be most concerned about the kids you don't even see back in school. You need to do active outreach to try and get kids back. And I was telling people at the very beginning of the pandemic, once this is fully resolved, when it's completely safe to go to school and no one has to worry about this virus, which may never happen, but isn't going to happen for a long time. But even if we get to that point, there will be a lot of kids that don't come back. And you need to look for them and engage them and actively bring them back because those are the ones I'm most worried about. And that's hard to do. So I think the absenteeism that we're seeing now since the pandemic, it not only was predicted, I was telling people, please do your best to make sure we minimize it. It's going to happen. So school avoidance is a very common one. Now, when you're thinking about kids' fears and adults' fears for that matter, it's important to figure out what is that individual fearful of and why. Because as you know, children may have very different fears than adults do, and adults have very, very different fears than each other. And you can't reassure people if you don't really know what they're worried about. We tend to just talk about what we're not worried about, or more importantly, why we're not worried about it. Physicians are horrible with this. Families come in because they are worried about something. We do a lot of tests, and then we tell them why we are reassured by the tests. They don't care about the test. I mean, they care about what the test showed you, but there's no reason to be showing them their x-rays or explaining what electrolytes are. We really need to say what it is, what we need to ask them. What are you worried about? And why are you worried about that? But if you go straight to offering reassurance without knowing what they're afraid of, then what tends to happen is you only talk about why you are not afraid instead of about what they're afraid of. And when two people each talk from their own perspective, I call that arguing, and I've never seen that actually help to provide reassurance. So you want to start by asking them, what are you concerned about and why? You also should be careful not to say you shouldn't be worried or in any way try and minimize their concerns. Instead, help them learn to deal with uncertainty and fear. You want kids to learn strategies for dealing with distressing feelings rather than pretend that they don't or shouldn't have those feelings. So that's the first one, which is fears and anxiety. The next one is sleep problems. That can be trouble falling asleep or staying asleep, difficult waking in the morning, or too frequent wakenings at night, nightmares, or really any other disruption in sleep. I also am now starting to specifically say after a crisis event, you should avoid co-sleeping if that is not your cultural preference, because it's very hard to undo that when you think you're no longer needed. Because usually the adult will decide they no longer want that to continue, but the child is now used to it, and it becomes another crisis to try and end that type of support. You can also see change in appetite or sleep. Now, I do want to say change in appetite or eating, I should say. I do want to get back to the sleep. a lot of times what people wonder is whether they should get medication for sleep. So I have never written a prescription for medication for sleep aids for a child who is having sleep problems because of a crisis or loss. I have for other types of situations, but not if it's due to a crisis or loss. So really what you want to be doing is sleep hygiene and giving advice on what strategies, practical strategies you can take to make it most likely that a child can self-calm and go to sleep, not so much that you give them medication that makes them not conscious. That doesn't teach them how to fall asleep. It just renders them unconscious. And then it's even harder for them to learn how to sleep. The next thing is difficulties with concentration, and that can cause problems, as you would imagine, in academic performance. For your educators, it will affect their work performance. And so you not only see kids having trouble learning, you have teachers having trouble teaching, administrators having trouble staying organized in their administrative tasks. And so you really want to make sure that people understand that that's part of the common reactions and you make appropriate accommodations and put in supports. You can also see sadness and depression. I remember talking in one school in New York City when everybody was still locked down. And this community had a very large number of deaths that had occurred among members of the school community, particularly when you included the families of the people that lived in that community. They had a lot of healthcare providers and first responders and others in that community. And the principal died suddenly of a health-related cause, not specific to that, not from COVID, but during COVID. And so I I was talking with him because, there was a new acting principal, and there were also some other issues about how that acting principal had been selected, and it just got very complicated. And he told me that he thought they were going to lose all their mental health providers because they anticipate all these financial problems. And he didn't know if the school would open before the end of the academic year. He didn't know how to prepare the teachers for their new academic assignments because he didn't know who was going to be there, and he had never done that. It just was a horrible situation. And he looked at me and he said, "The morale is poor." I'm kind of like, well, of course it is. Like, what else would you expect? So there's a certain amount where sadness, discomfort, that's to be expected. Clinical depression is not. So if you have a child who's sad because all these people died, they're supposed to if they're empathic at all. So, but they shouldn't be clinically depressed. So this is when you bring in a mental health provider to say, is it sadness or is this clinical depression? Should I understand that this is what they should be going through, or do I have to be worried because this is what this child is experiencing? You will also see anger and irritability, and I will come back to this later because I think that's part of what we see and are still seeing, and it become after the pandemic, and it becomes very difficult to manage. You can also see alcohol and other substance use. So you need to ensure that substance abuse evaluation and treatment services are part of your recovery plan. Often counselors and other mental health providers in schools are not, don't feel comfortable doing evaluation for substance use, but in a crisis that increases. I was in China after the earthquake, as I had mentioned, and I was talking to one teacher. Now, this particular school had collapsed, and about, I think, 40% of the students and staff died, and the others were buried alive and dug out. They had been relocated to a resettlement community. We were standing in a tent in the resettlement community, and I just asked the teacher, "How are you and the kids doing?" And he looked at me and he said, "Well, they're smoking tobacco more." They were middle school. That's what they had access to. And then I said, "How are you doing?" And he looked at me and he said, even though his principal was standing right next to him, he just, without pausing, he just said, "I drink every night to fall asleep." And so you see a lot of alcohol and other substance use, which is why I recommend we discourage the use of alcohol after crisis events, when we're socializing or when we're having school-related functions or organizational-related functions. One of the trips in New Orleans, I went over this, and the school mental health provider that was hosting my visit actually said to me afterwards that was about 3 weeks after Katrina, and her daughter texted her to ask where she was because she hadn't come back from school. And she texted back, "Oh, don't worry, I'm out with friends at school at happy hour." And her daughter texted back, "Mom, you've been in a happy hour every day since Katrina, and you don't seem happy to me at all." And her mother just looked at me and said, "I realized then I was drinking too much." And so please be aware of this. I've had now multiple situations where we've gone to do training with staff after a mass casualty event, and they're not available because they decided to go out for happy hour instead on their professional development day. I really would discourage that. I don't think that's not effective coping. And for those who are vulnerable, it can cause misuse of alcohol and other substances. You can see physical symptoms like headaches, stomach ache, and it could be due to psychological distress that it presents as physical symptoms, but it can also be just the stress hormones causing physiological effects. And so, stress hormones will raise blood pressure. Um, I've I even had one principal who had a heart attack afterwards and needed bypass surgery right after a mass shooting. It can increase your blood sugar in individuals with diabetes. It can precipitate asthma attacks in individuals who are susceptible to asthma attacks. So you often have a combination of both, and that's why school nurses really have a lot of work to do after crisis events. Now, they're doing it on a day-to-day basis, trying to sort between this, but after a crisis, it's really even more widespread. And then children may demonstrate post-traumatic symptoms, and some will meet the criteria for post-traumatic stress disorder or other stress mental health problems. But I'm not going to talk much about that, although I can answer questions on that. And I should have said, please start putting questions at any point into the chat, and we will take time at the end, at least the last 15 minutes will be just for questions and discussion. But I'm not going to spend as much time talking about post-traumatic stress disorder because I think we've done a pretty good job of making sure that people recognize they have to be trauma informed. We've not done as good a job having people look for other things that are important, and one of those is grief. Now, crisis can cause widespread distress among children and adults, but not all of this represents trauma symptoms. And the challenges that it will be facing many children and adults often relate more to loss and grief. So we're working with all these schools that have been impacted by the wildfires. But most of these people didn't actually experience a feeling of life threat at the time. A lot of them evacuated before the wildfire got out of hand in their community. Not all. Some of them did escape, feeling that their life was in jeopardy, and they are at high risk of getting trauma reactions or traumatic stress. But a lot of them got out in time, but they just lost their home, lost their community, lost their school. And a lot of them really are dealing with grief and loss. I remember talking to one person after workshop when I went over the difference between trauma and grief, and she came up to me and she said, "My house was destroyed 6 months ago, and I just have not been able to concentrate. I can't sleep well." And I kept thinking, why am I doing this? I wasn't under that much stress at the time. I shouldn't have post-traumatic reactions. And she said, and now I realize I'm just grieving the loss of my home and my community. So this has really helped me contextualize it. So I think sometimes we go right to thinking it's trauma. I had one young adult, as a teenager, and he had been in a mass casualty event, and the person on either side of him was shot and killed, but he was uninjured. And so he declined counseling, came back to school once, but only stayed a couple hours. And I went to his home with some people from the school with his permission and asked him, "Why aren't you in counseling?" He said, "They just keep wanting to talk about the shooting." And he said, "Look, I had some trauma reactions for the first week. Couldn't sleep. I was jittery. I reacted to to sounds." And so he said, I had that, but it's gone now. It's better. Um, and I said, "Well, then why aren't you in school?" And he said, "It doesn't feel right being there without her." And he went on to explain that it didn't feel right because his girlfriend wasn't there. He had been in school with her since kindergarten and was planning on marrying her. She was one of the people killed on one side of him that night. He said being in school without her just didn't seem right. I said, "Well, maybe you're grieving the death of your girlfriend." And he looked at him and he goes, "That's it. And if someone will talk to me about that, I'll go for counseling now. I just don't want to keep talking about the shooting." So sometimes we have to realize that it isn't trauma that's the predominant issue. It's grief, or it's both. And the interventions that are designed for the treatment of trauma may not be optimal for grief. At a very basic level, when you're addressing trauma, you're focusing on helping the person cope with something that happened to them in the past. Complex trauma, it might have happened repeatedly, but it's something that's happened in the past. But support for grief focuses instead on helping people cope with loss. It's really not about what happened, but it's about what's absent for the rest of their life. And so it's a very different type of context. And so it isn't surprising that what you would do isn't going to work equally well in both situations. I was on the Sandy Hook Advisory Commission, and one of the parents came in the spring, and she said that she opened the yearbook and found that the photograph of her child who died that day had been removed, as did the photographs of all the children and adults who died. And she said, I don't know, what were they thinking? It's like they never existed. Now, I didn't talk to that yearbook committee because I was only working with that school for the first week and then had to take a position out of state. Um, but I have spoken to other yearbooks about these issues, and they tell me they remove the pictures because they are trauma triggers. I explained to them, no, pictures of healthy children and healthy teachers when they were alive and well are not trauma triggers. They're grief triggers. They're reminders of what we lost, not of a traumatic experience. And that most people, they fear more forgetting people that are important in their lives than remembering the grief associated with it. Because the grief is a sign of your continued attachment. People go to cemeteries, they have memorial services, they do things that remind them of what they've lost because forgetting is worse. And so in grief, it's not that you want to have a grief trigger, it's that I had one adolescent say to me she was having grief triggers related to her dad, who died 4 years prior. And she said, but you know what? I kind of like them now. It helps me stay connected to my dad. It reminds me of how I miss him. So, very different what you do for grief and what you do for trauma. We also have to realize that grief is not just because of death. Grief due to a death of someone is called bereavement, but there are many other things that we grieve. So in Hurricane Maria and San Juan, the majority of children in one study reported they had lost someone close to them, but it wasn't from death. It was because they permanently relocated off the island. And so that's what we're seeing now in the Palisades and Altadena, is that people are just starting to lose important or have lost important connections with their friends and family and their community. And so we have to really be looking for grief and address that directly. And the last thing that I have up here is guilt. People manage to find reasons to feel guilty, irrespective of their experience or their role after a crisis or loss. At some level, it may feel easier, at least unconsciously, to accept responsibility, which leads to guilt, rather than to recognize it's out of your control. Because one of the things you're most anxious about is, can this happen again to someone else I care about? And if you have to say, I didn't know control over this, like, of course it could, then that made me feel intolerable. And so often what happens is they accept this illusion of control. There's something I did, didn't do, should have done, or could have done that would have changed that. Because if you accept responsibility, then you may feel more powerful to be able to prevent it from recurring. The problem is when it's an illusion of control, it doesn't work. It's not actually going to decrease the risk of it happening again, but it leads to guilt, which impairs adjustment. We also see survivor guilt or guilt for not having even experienced the loss or trauma. So I like this cartoon from Calvin. He runs in and he asks, he calls for his mother and he says, a big dog knocked me down and he stole Hobbs. I tried to catch him, but I couldn't, and now I've lost my best friend. And his mother says, well, Calvin, if you wouldn't drag that tiger everywhere, things like this wouldn't happen. And he points out there's no problem so awful that you can't add some guilt to it and make it even worse. So I tell people to look for the guilt because it's likely there in a large percent of people. Now, there's a similar mechanism that leads people to feel angry. I'd mentioned anger and irritability. So sometimes people, parents and caregivers, don't blame themselves for what happened in a school crisis. They blame someone else, and it's probably you if you're in that school. So it's the school leader. You must have done something wrong because they can't keep sending their kid to school where this could happen again. So we get these calls to replace principals, assistants principals, superintendents. I've seen them indicted, placed on administrative leave. And it's often very destructive because they actually know the kids the best and know the safety situations and can help stabilize the school and promote recovery. But often they are the target of that. And so sometimes it's helpful to understand that's why it's happening. It's because it's intolerable for people to feel that nothing significant has changed. So we're seeing this in my own community. They've, tried to get rid of the head of the fire department because of the wildfires. Then it's the mayor. Somebody had to make a mistake. Somebody had to do something wrong. Now, we should learn from what's happened and try and improve things. And of course, people don't have perfect responses. But this having to replace and attack people who were in charge when there's been a crisis is a common reaction, and I think quite destabilizing for schools. Now, all the reactions that I went over could be due to the particular crisis, but it may be what followed the crisis. So I often tell this story. I was talking to one school professional in New Orleans after Katrina, and she told me that she rented in the French Quarter and her apartment was completely undamaged. And she wasn't there when Katrina hit. So she said she was lucky. She was able to come back to her apartment. But unfortunately, her luck ran out when the lease ended. And at that point, the landlord doubled the rent. She couldn't afford to stay at that cost, so she had to move some distance away. So she said she functionally lived out of the trunk of her car. But then what happened was that her daughter started to get depressed because she had to pull her out of her high school in her junior year. And so she was about 45 minutes away from where she lives. So she was socially isolated. So she got started on some antidepressants through an emergency room visit, but the mother couldn't access counseling. There were many barriers at that time. So someone suggested, why don't you get her a pet? Get her a comfort dog. So she got a dog, and the dog attacked someone in the throat. And the mother looked at me and said, I'm going to be going to court next week. My attorney tells me I will likely be bankrupt by the end of next week. So she didn't have post-traumatic reactions to Hurricane Katrina. She was just reacting to everything that followed. And I see this after many crisis events, whether it's a school shooting. A lot of times it causes financial stressors, and then layoffs are required. So there's just this cascade of secondary losses and stressors. And in addition to that, there are just concurrent losses and stressors that might be unrelated to the crisis, like whether it's immigration enforcement, being part of a marginalized minority group, or experiencing poverty, or all of those may be happening in a particular child or part of your community. And then that leads to kind of what we call cumulative stress. And there's also a term that's used in terms of intersectionality that you have, it's like the Venn diagrams, and you've got this stuff in the middle because you belong to one of these other groups or have these other stressors. And so we just need to think about how that may occur. And a crisis may, and it's not just everything that followed and everything that's happening at the same time. It's actually everything that happened beforehand. So a crisis often awakens feelings related to a pre-existing or even past crisis, which may not be related in any particular way. I went to one school and I went over this point, and one of the staff was apparently crying for the rest of the night. And he came and met with me at the school the next morning. The principal greeted me and said, "You got to talk to this teacher. She's been crying ever since your presentation yesterday afternoon after school." So I met with her and I was like, "What's wrong?" And she said, I wasn't in school on the day of the shooting. I never met the child that was killed, but I was struggling. I couldn't sleep. I couldn't concentrate. I felt depressed. And I kept asking myself, why? Like I wasn't even there. I didn't see it. I didn't lose anything. And she said, and then you made that comment, and I realized the day that child died was the 10-year anniversary of when my brother was murdered. She said, I didn't even make the association, but I usually had anniversary reactions, but this time it lasted 3 weeks. And I just couldn't get out of it. And then as soon as you told me that point, I knew that's what's happened to me. She said, I just came here to thank you. And she looked at me and she said, I think God sent you here to deliver that message to me. I thought she was going to be upset that I had made her cry. And she said, that was really helpful. I'm good for another year. So sometimes people don't even make the association. Now, we also know that people, I already talked a little bit about irritability, but we have to realize that when kids are stressed, and adults for that matter, they can regress socially, act less mature, become more demanding and more selfish, or have more difficulty getting along with peers or family members. At a certain level, everybody keeps saying, these kids they have emotional dysregulation. They're not as socialized. It's because they weren't in school for a significant period of time 4 years ago because of the pandemic. And that may very well be a major factor. But for me, a million people dying is a huge stressor. And it probably affected a lot of the kids and staff very personally. And so people do this when they've been through traumatic experience and through significant losses. And so some of this, I think, is because of not just being in school. It's what happened while they weren't in school. That people were dying and they felt they and those they loved were at risk. So a lot of times I hear people say crisis brings out the best in people. It really doesn't. And yes, you will see occasional acts of selflessness and heroism, and that's wonderful. And we should focus on that, in our conversations and in the media. But for the vast majority of people, it brings out their stress. And we're not going to be at our best all the time either. And so being around people who are needy, demanding, self-centered, or distressed is really not particularly fun or satisfying, and you may find yourself in that situation now. So please be patient with students, families, staff, and above all, be patient with yourself. So try to set reasonable expectations and communicate that to children, parents, educators, and other school staff. Children just aren't going to learn as much schoolwork during a time right after a crisis as they would have been, not just if we keep the schools open, but it's because of the crisis as well. I've actually been to schools that have had large-scale disasters in their community, but the building wasn't affected, and they opened school the next day. Or I've seen that there's been a mass shooting, and they have opened school within a day or two. Kids still don't learn as well, teachers still don't teach as well, and you still see ramifications for months and years afterwards. So just realize that if you push the educational expectations too far, even temporarily, then school becomes a source of distress instead of a sense of support. We really need it to be a source of support. So it's really important for educators for education leaders like yourselves to say, look, we're going to meet where the kids are and we're going to bring them forward together, but don't give unreasonable expectations. Now, that gets into academic accommodations. I'm not going to go over this in much detail, but I can answer questions about it. But it's common for students to experience at least temporary academic challenges, whether that's after a death of a family member or a close friend or a major crisis. Pre-existing learning challenges often become worse and new ones can develop. So you really want to offer academic support proactively. Don't wait for academic challenges to become academic failure, because then the child often can't get promoted and then they lose their peer group as well. You may need to change an assignment. So allow a student to work with a partner instead of doing a term paper by themselves. But sometimes you have to adapt formal research papers into more engaging assignments like a group project or maybe a video that they develop. Some kids don't want to be videotaped when they're grieving or in crisis, and sometimes they don't want to stand in front of a class either. So there isn't like a right way to do it. It's just that you have to work with the kids. So it's like differentiated learning, but on steroids. Sometimes you also want to change the focus or the timing of a lesson for the whole class. I've now had a couple situations where a child was shot in the head in front of a class, and the next book was going to be of Mice and Men. I remember the first teacher that pointed that out and said, they really liked that book, but would that be hard to read now since one of the characters died by being shot in the head? I just I didn't answer, and he goes, okay, that is the stupidest question I've ever asked. Of course, that would be difficult. And I said, no, I'm glad you asked the question. I just was doing a presentation in the spring, right before schools stopped for the summer, in a community that had wildfires. And I went over this point, and one of the people in the audience just said, oh my God, our required summer reading list includes Fahrenheit 451. As soon as I get out of here, I'm removing that. So you really have to look at what are you teaching? How does that fit in the context of what people have been through? You may also need to reschedule or adapt tests or change grading. So there's a lot of different accommodations you can make. I can go over some of those more if you have questions at the end. I want to turn a little to resources before I talk a little bit more now about support for the adults. So the first thing is to say, I mentioned the Coalition to Support Grieving Students. AFSA, NASP, and NASSP were three of the 10 founding members, in addition to the New York Life Foundation and my center. It also included at the School Superintendents Association, for school administrators as well, the two teachers union, the AFT and the NEA, and the major association representing school counselors, school nurses, school social workers, and school psychologists. We came together a little more than a decade ago, and we launched a website. And when we launched the website, more people asked to join. So now we're up to more than 150 professional organizations. We continue to meet. Our next meeting is in a week and a half. And it includes groups like Boys and Girls Club, the National PTA, Save the Children, the American Academy of Pediatrics. It's a pretty long list. And hopefully you know that your three organizations actually placed their logos on the material that we developed. And when we developed them more than 10 years ago. So we have a website, grievingstudents.org, which houses more than 20 video-based learning modules. Most of them are 10 to 15 minutes in length. They cover a wide range of topics on how to support grief in students and staff. They're mainly 10 to 15 minutes in length, and they have print summaries in PDF. We also have materials. Here's a booklet, After a Loved One Dies, which is appropriate for parents and other caregivers. It's available in English and Spanish in hard copy. I think it's about 30 pages long. And you can order them free of charge, and even the shipping and handling is free. But you can also download them in PDF in 10 different languages. So this is a free resource, which hopefully you know about and can use if you have the need. We also have tip cards, what to say and what not to say, related to grieving students. That's available in English and Spanish, and again, is free, even the shipping and handling. We have also developed tip cards for what to say and what not to say for death after suicide, what to do after disasters. Those should be available any day now. We're just waiting for the layout to be completed and for them to be printed. So now I want to turn to, okay, how do you recover from these things and how do we take care of the adults? That's when we cover on the last 15 minutes. So first off, this slide just kind of goes over adjustment over time. A lot of times people ask me, when are we going to get back to the way we were? That's easy. Never. These are life-changing events. You don't go back to the way you are. You move forward and incorporate it. But we all have a baseline of our adjustment. And it's not a straight line. So there are days where things go well and you feel better. And there are also days where things don't go well and you don't feel as good. You don't feel as you're coping as well. But the point is you come back to your baseline without any external support. That's what people do in most situations. But when a crisis occurs, that means that they have exceeded their capacity to cope without external support. Crisis events are not defined by the events themselves, but rather the person or system's capacity to cope without external assistance. So the idea is, when we talk about resilience, we're not trying to make people not get upset about something upsetting that's happened, but rather to be able to cope without external support. So you're really trying to turn a crisis into a distressing experience. But I mention that because even people who are resilient, like school leaders, still benefit and should accept support from others and offer support to their colleagues, even if they are resilient. But here a crisis has occurred. It exceeds the person's capacity or system's capacity to cope. External support usually appears. People bring money, they bring food, they bring social connectedness. That's why some people have called it a honeymoon period, because that's what we do when people get married. I don't like to use the term honeymoon period because it suggests that marriage is a disaster. So you start to get better initially. I will just say parenthetically that when people start to do better is actually when they're most vulnerable. Most people don't act on thoughts of self-harm when they're extremely overwhelmed. It's usually when or it's more commonly seen after natural disasters with adults. I haven't seen this much with kids, but with adults, where the suicide rates may actually increase in communities when most people seem back to the way they usually were. And that's because most people hide their distress, but they are functional. And those who have lost the most and are feeling the least functional may inappropriately conclude that they will never get better. And that's where self-harm starts to increase. We saw it after Katrina in New Orleans. We saw it in Maui after the wildfire. But again, this is in adults, not in school children. But the kids start to get better. And then I've heard people say, look, the kids are better. They're better. They're just not all better. And so if you withdraw the supports too soon, some students won't return to their baseline level of functioning. They just have continued impairment. We owe it to kids and adults to make sure they have enough support so that they can get back to at least their baseline. And for some individuals, they will exceed their baseline. And we call that post-traumatic growth. They may emerge with a sense of new spirituality, more empathic, more able to help others, have a better sense of what their purpose should be in life, and be more resilient to future adversity. It's not a good thing because it's a horrible way to get there, but post-traumatic growth does occur. So individuals are changed forever by major crisis events, but they're not always damaged. And that's something I usually like to tell people. I think all of this, this is what trauma does to the brain, suggests you're just damaged. And that's not true. Some people actually emerged in the minority with post-traumatic growth. So I was going over this with a group of foster parents after a large natural disaster in their community. And one of the dads says that just raised his hand. He said, I think I went through post-traumatic growth. And I asked him what happened. And he was a young guy, happily married, had a toddler that he loved. He was working on Wall Street. He was successful. He was making a lot of money. And everything was going well until his toddler got sick and died. And he said, and then I just questioned everything about my life. And one of the things I questioned was what I was doing for a job. I said, look, a career is something that changes the world. I had a job. I made money for people who had money, but didn't make the world a better place. So he quit his job on Wall Street, even though he was doing well, and went back to college with the goal of becoming a kindergarten teacher. He said, changing the lives of a young child, that's a career. That's important. He became a foster parent. He was going to adopt his child. And he looked at me and he goes, is that post-traumatic growth? And I'm like, yes, it is. But the problem is that when you deal with someone else's crisis and loss, it uncovers feelings you had about your own. So people who are in helping professions are often there because someone helped them when they had a crisis or loss as a child. People don't become kindergarten teachers because it makes a lot of money, it's easy, or it's very prestigious. They do it because they care deeply about the lives of children. And that's what many people in education are. We see it in pediatrics as well, and mental health. And those people are more likely to have had their own crisis or loss and more likely to be impacted by helping others. So I wanted to spend the remaining time just talking about how do we take care of the adults. So the first thing is, I said I was going to talk about self-care, professional self-care. But before I do that, I want to talk about the fact that the well-being of professionals is not only an individual responsibility. Research has shown that organizational approaches to burnout are more effective than individual approaches. At the very least, organizational leaders have to establish policies and practices that promote employee well-being, cultivate a culture of institutional support for professional staff, and provide tangible resources and supports to professionals, especially during the immediate aftermath of a crisis. Otherwise, we risk implying to professionals that they alone are responsible for their well-being and lead them to feel they have failed professionally if they're feeling stressed when placed in an inherently stressful situation, such as facing many school professionals on a day-to-day basis, but particularly in difficult times like we're having right now. And so we really need to turn first to support for staff. So there's organizational support that you can provide. We find after a crisis event, it's often useful to have substitute teachers. So that might be right afterwards, so the substitute teachers can relieve teachers if they need to step out and take a break, if they need to check on their own house to make sure it's being repaired, if they need to take a child to go see a mental health professional. You want them to be able to have some respite and some support. You would also want to increase this, for example, if there's a trial for the shooter, or the anniversary, or 1 year when after the event has occurred. Sometimes you can pair teachers so that they can co-teach, so one can leave if they have to. Or sometimes you bring in student teachers or other people who are less impacted in the district to help out. Sometimes we can't afford a lot of substitute teachers, but I think it is useful to consider. You'll need to modify the workload and some of the expectations. I've seen staff be appreciative from simple things like just the lunches provided by the PTA. So it's one less thing that they have to do when they're feeling stressed or overwhelmed or when they're displaced because of a natural disaster. I've even seen teachers talk about how much they appreciated Casual Friday. So one day out of the week, they can get ready easier and faster. Supportive supervision is helpful for your clinical professionals, your social workers, your psychologists. They're used to dealing with some distress, but not at this level. And so having a clinical supervisor can help them make sure they're doing a good job, but also deal with their distress. Professional development is important, and also, hopefully, many of you have employee assistance programs. But one of the things I will say is that employee assistance programs are the support that we provide for adult professionals is not the same level of what we suppose to provide for the students. Students, their mental health is part of the whole child approach, and we have mental health services for them. Adults, they're supposed to be healthy emotionally. And so they get it as an employee benefit through HR, and it's usually not of the same degree as what the students have access to. So there have been now a couple situations, major crisis events, where we've encouraged the school and they have actually provided what we call kind of on-site EAP, where they've had someone come to the school and be present on an ongoing basis to be able to support the adults in the same way we're trying to support the kids. You can bring family and you can foster family and peer support. So bring your staff together for social reasons during the recovery and have them include their significant others. Or you might include them in kind of professional sessions talking about the impact of the disaster, because a lot of times spouses and other significant others don't know how to help the person that they love. And then uncouple student and teacher performance, at least in the immediate aftermath. So pay increases and promotions are often based on academic performance of students, and they don't perform as well after there's been a disaster or a crisis. And clarify that when you're in class doing observations as part of your performance evaluation, you're not there just to judge them. You're there to actually figure out together how you can help them do a better job. I had one school, it was a very rural school. They had a large-scale natural disaster, but they also had a cluster of suicides in their middle school. So in one grade, they had a small number of students, but about 5 to 10% killed themselves in 1 year. And it was an overwhelming situation for the school, and they had very little mental health resources broadly in the community. So we went out there, and at one point, one of the teachers asked to speak with us alone. And I talked with the teacher, and she explained that she was a new teacher. She had just graduated a couple months before. This was her first job. She was proud of the fact it's the first time she moved out of her parents' home and got her own apartment. And she said, but it's been really difficult for her. And part of what's so difficult is it's hard for her to talk about suicide because she had tried to kill herself just a couple of years ago in high school. And trying to talk to the kids during this suicide cluster was very hard. She said the other day the principal came in to observe her, and she said, I didn't do a good job. I was just so anxious, and it's just been so hard. And I asked her, well, why don't you tell the principal that this is going on? And she said, no, I'm on probation for my first year. If I lose this job, I lose my apartment. I'll have to move back in with my parents. Everything's riding on this. And I can't let the principal know that I have any vulnerability or weakness. So you can imagine what that's like for the teacher. So just make sure I think you should always be sensitive about that there may be stressors in their lives, but after a crisis, it's particularly challenging. So then let's just talk briefly about self-care. It's distressing to be with students and staff who are in distress, and it's really critical that we all find ways to have our personal needs met and appreciate and address the impact of supporting students who are grieving, traumatized, or otherwise distressed. We really need to create a culture in our professions where it's okay to be upset when upsetting things happen, and where members normalize asking for help and model a willingness to accept assistance. And so one of the things we have to realize is that the exposure to the trauma and suffering of others can lead to what we call compassion fatigue. So empathy involves understanding and taking the perspective of another, but compassion goes beyond that. It requires that you also want to help and or desire to relieve the suffering of someone else. So compassion has its Latin roots to bear or suffer together. And it's that shared experience of suffering that leads to warnings about compassion fatigue. But these warnings tend to imply that compassion is necessarily tiring or exhausting. If we care too much or about too many people, we'll get overwhelmed and burn out. And that's not necessarily the case. Compassionate approaches actually can be gratifying. They bring meaning to the work that we do. It leads to compassion satisfaction. We only talk about compassion fatigue, but we have to talk about how do you get to compassion satisfaction. And that requires that you have realistic objectives of the purpose of your interactions. If you're helping someone whose home has just been destroyed or someone they love has died, you're not cheering them up or making it okay. You're just helping them begin to cope with it. And you have to recognize that that's your objective and be satisfied with that. You have to have the skills and the resources to provide what you consider meaningful assistance, and you have to feel empowered and supported by whether that's your organization or your supervisor to provide this help to others. Otherwise, you risk moral injury. And we have to be aware of and have sufficient support to deal with the personal impact of the work. So you have to be introspective of the impact it's having on you personally and professionally, and make sure that you attend to those personal needs that you have. Adults should also be aware that hearing the stories of individuals impacted by crisis event, when we are compassionate, can transmit some of that trauma to the helper, and that we call vicarious traumatization. So as a school professional, you should realize you don't need to listen to the trauma narratives of everyone that have been through traumatic experiences. Really what you want to do is just listen enough so that you know they've had a traumatic experience, and then direct them to someone who can listen to them and provide trauma treatment. It isn't actually useful for people to keep repeating their trauma narrative if all you do is say, oh, that's horrible, I have no idea what to do. So just listen enough so that you can connect them to the services they need, but also protect yourself. Now, I mentioned moral injury, so that's the last thing that I was going to talk about, was what do you do about moral injury? Professionals may experience moral injury when they feel that in their professional role, they're not allowed to do the things most needed for students and their families, such as after a crisis or even just when they're dealing with adversity. So if you have to say to someone, well, I really wish I could spend more time providing support, but we have to get back to academic recovery, then you start to feel like, I know there's something else I should be doing and I'm not allowed to do it. Moral injury can also result when we assume that we or our organization actually has more control over a situation or outcome than we actually have. So in our conversations with one of the largest school districts, they're dealing with immigration actions that are being taken and people being put in detention and deported, and they feel like they should be able to do more. But they have a limit to what they can do, and that's what's the most difficult part of it. But I remember at one point they were starting to close down shelters for immigrants in the city because what was happening was the shelters were disclosing the immigrant status to federal immigration officials, and they were then coming and deporting them. So they realized that was not a safe place for them. But while they started to close them down quickly, a lot of the kids and families didn't have secure places to live. And I remember talking to people in the school system virtually, and they were like, why are we providing housing? We should provide housing for these families. And my reaction was, schools don't provide housing for people. Like, that's not something your organization can't do that. That's not what it's set up to do. But they were kind of like indignant that this was what was happening. So if you feel like you should have more that you can do, or your organization should do more, sometimes that leads to moral injury. So let me go over the strategies. First off, challenge perfectionism. In crisis situations or other situations of scarcity and adversity, You have limited choices, and you can't always do everything you think you should do, and you have to accept that you have those limited choices. Identify ways to advocate within the school, district, and community for more services or support to those in need. If you think they need more help with this, try and figure out how and advocate, but within the system. Like if we provided more of the support, they would actually do better academically. These are some ways we might be able to do it. But if you can't do it within your job, then figure out how you can do it outside of your job. Stay after school, work with the community organization if the school can't provide some of the services that you think people really need. And then rethink responsibility. Responsibility is not all or nothing. We can feel some responsibility for unfortunate events and feel badly that we didn't or couldn't have done more. But that doesn't mean we had the primary responsibility for causing them. So you might do your best as a school leader to create a culture and an environment where there isn't bullying, where people are treated well, and that won't go 100% well. And there may be a child or a staff member who harms themselves, and you think that might be due to it, but you didn't cause that. I went to one school, they had had a mass shooting, and that's while I was there. The mass shooting was actually in the community, but the principal was really a great principal, and he wanted to make sure he got support for his staff. And I went over this and a lot of the stuff that I've already gone over. And at the end, he pulled me aside and he said, 3 years ago, there were several students in this school who died by suicide in 1 year. And people implied to me that if I had been a better principal, maybe these kids wouldn't have died. And he said, I lived with that for 3 years. Like, where were you then? And so when I checked with him afterwards and asked how they were recovering from the shooting, his comment was really, we're just starting now to heal from the suicides that happened 3 or 4 years ago. That was something that was really very hard for him, as you can imagine. I also tell staff to be an advocate for both the school district and your students. So make sure that taking on the role of an advocate for students and family doesn't conflict with school or district policies or practices. If you ever find yourself saying things like, well, I know you have to take this standardized test. I didn't think you should do it. I think it's wrong that the district requires it, but that's what you got to do. That isn't helpful for you, for your job. It isn't helpful for the kid or their family. So make sure that you're responding, but you're responding within your role. And the last thing that I have just as advice is recognize it is hard to be a leader, as I mentioned, and you can call the National Center and we'll help guide you through this and be a partner with it. But there are a number of specific challenges that no matter what you do or how well you do it, you're not going to make everything okay. So please recognize that that's a limitation for any leader. Those impacted by a crisis often react to feeling out of control by trying to exert more control. So, and people will have very different views about what should be done and feel strongly about those views. So that may be related to safety. When is it safe to reopen the school? Should there be more security guards or less security guards? What's the timeline for returning to academic focus? Issues, commemoration memorialization is very tricky. So please call on us if we can help with that. And then the use of funds, whether they're recovery funds or the limited budget that you have. And know that the reactions can challenge working relationships among your team. And one of the big challenges is you don't have the luxury to stop and focus just on recovery. You got to do the rest of your job. So that's why we have recommended to a number of school districts that they actually get a recovery coordinator. And there is funding that you can receive from some federal sources and local foundations to be able to help with that. But sometimes it's just too much to layer onto the role of a school leader. These are just slides on resources. This is our website for the center where you get more information, schoolcrisiscenter.org. We have guidelines there on how to respond to a death by suicide, how to respond to a death by all causes. They have embedded links which will point you to other resources. And we have a guidance document in English and Spanish, as in this, what I'm showing you, which is how to talk to children about terrorist events and violence in the media. And this is just information on how to contact the center. You can get a copy of these slides and a QR code for you to give feedback on the presentation.